we're talking about hygiene.
Yeah, I'm talking about hygiene. So we give them a bath. I give them some health education talks whenever I meet. They must brush their teeth. When I look at them from the physical point of view, I see that a lot of these children have poor weight. They are underweight, and because of chronic, sometimes malnutrition, many of the children do not have adequate heights. There are other things that I find in them is anemia, which is lack of hemoglobin and iron. This is not taking nutritious food. They have bad dental hygiene. Most of the time they are suffering from nose, throat, ear infections, sometimes eye infections, sometimes chest infection, bronchitis is very common. We also treat children with stomach problems. Sometimes they eat food outside which may be contaminated and they can have vomiting or diarrhea, and sometimes they need constant deworming medicines. Many times we have seen a lot of skin diseases because they have been sleeping on the floors and in carpets or places where things are not clean. So we see a lot of scabies, which is skin infection. We see a lot of the rainy season, particularly a lot of pyodermas or pus points or boils on the body, and a lot of other infections, right from tuberculosis once in a while. Amoebic infections are also very common, and we have picked up a lot of other children with disabilities. There's one child I just saw, he's deaf and dumb. So if he's deaf and dumb and he's also on the street, so it's very complicated now. There's another child I just saw they suffer from a lot of injuries. So they sometimes they have injuries due to accidents, sometimes on their own, because they are many times walking on the streets barefoot. So if they get needle pricks and all, we need to immunize them from tetanus, hepatitis B. If they have fractures, we have to send them to the hospital. One has got a cost, you can see. The child who's deaf and dumb, I mentioned, he needs to go to a special school, needs some special assistance, and those have to be arranged for.
Okay, and so how do they take the medicines you prescribe them? Like, how can do they come to the center?
Yeah, well, it's we have the clinic right now, like we're having an ongoing clinic right now. So all those 28 children we have here, depending on what their needs are, I do my examination, write my salient findings, and give them the injections myself. Then as far as the medicines are concerned, then we have a social worker, a medical assistant for me, who has all the medicines that I've prescribed. So at the end of the day, she gives them, and she also supervises that they take those medicines throughout the week or more as they're required.
Okay. And what hygiene recommendation do you give to the children when you see them?
Yeah, the first thing I did is that they must take daily bath. They must hand wash before touching here and there. Hand washing is very important. Just basic brushing, dental care. They must wear shoes, socks. If whenever I find that they go to the bathrooms, they're sometimes not cleaning their hands, so that's not good. After eating the food, they must rinse their mouths. So it's just basic hygiene tips. We make sure they have good soap and bathing facilities. They can wash their clothes if they're too dirty. They should be wearing those same dirty clothes. And so these are the basic things that we talk about, and we inculcate them a kind of a sense of a routine. So once that comes in, besides the healthcare, you know, in the morning there's a social worker who specializes in non-formal education.
Okay.
So give them some training on the sites. They get a meal during the day, and then there's also time for fun and recreation.